Historically, when a patient has an elevated PSA and a negative biopsy, they get followed over time with repeat PSAs. The problem there can be that they have a persistently elevated PSA and therefore get rebiopsied, which again could be a negative biopsy. And they fall into this endless cycle of repeat biopsies. And we've seen some patients with 3, 4, even 5 rounds of biopsy, which creates a lot of anxiety for the patient. Each biopsy itself could have its own complications. And we didn't have good tools to really determine who really needed a repeat biopsy versus those who we could pass and believe our initial biopsy was a true negative biopsy. More recently, there have been advances in what we call molecular diagnosis. These are diagnostic tests that pick up molecules produced by the prostate, and particularly prostate cancer, that could help us with those decisions. The first approved test for the repeat biopsy scenario that we're talking about is a urine test called PCA3, marketed as Progenza. More recently, that company has sold that test to another company, and the availability going forward is uncertain at this time. Another test is available, and that test looks at the tissue itself that was removed at the time of the initial biopsy. Since that biopsy tissue is available, having already been obtained by the initial biopsy, the idea is to glean as much information from it as possible. The advantage here is you don't have to have another blood test or provide another urine test. That tissue's already been taken. That test is called the Confirm MDX test. It is put out by a company called MDX Health. The idea is that there is a field effect in the prostate that is associated with prostate cancer. That effect can be in the benign tissue surrounding the prostate cancer. So if you've sampled that tissue, you can get this test that looks for something called methylation abnormalities in the DNA. These are things that the body uses to help shut down protein expression from the DNA. But it can be used by cancers to progress. And by looking at these changes within the benign tissue, it helps us decide who is likely to have cancer and who is not. If you have increased methylation events in your benign prostate, you have a high likelihood of having cancer on repeat biopsy. Whereas if you don't have these methylation chances, and this is most important, then your likelihood of having cancer on repeat biopsy is quite low. And in that case, you could avoid having a repeat biopsy.